The round bottom one.
I think it's recording now.
Okay. So you got my audio? My name is Annette Moreta, and I'm doing a presentation on the impact of prior authorizations for Fox Valley Technical College for the technical reporting with William Mempison. My current position, I work at a health insurance company, and I get daily emails regarding prior authorization denials. So the purpose of my report is I want to bring awareness to the current prior authorization process and offer some recommendations on how to improve the process. There's impact on providers due to the prior authorization process. There's specialties that require more authorizations, such as durable medical equipment, pharmaceuticals, therapy, radiology. And 90% of claims denials can be avoided, and actually 70% of those are due to prior authorizations. A case study that I found based on 9 New York physicians, they looked at the analysis over a 4-week period of time, and there were 435 completed event forms. And per full-time equivalent, they found that the annual cost per physician is $2,161.75. And the American Medical Association, they say that physicians spend about 20 hours a week working on getting prior authorizations. So as you can see from my table, Table 1 shows from the 9 New York physicians the analysis that the different departments of medical equipment, medication, the highest for time was actually the radiology and then the medication. And they were the highest number of event form count also. The next table you have in front of you demonstrates the cost per staff role. So like the physicians, it was $2,165 annually. Registered nurses actually have a higher cost, and that's because they do a lot of the prior authorization requests. And when looking at this table, you do have to figure like a physician assistant gets paid more than a registered nurse. So as you can see, the average cost for physicians is the highest, followed by physician assistants, and then is the RNs. So prior authorizations also have an impact on patients. The reason is because these physicians are spending about 20 hours a week obtaining prior authorizations. That's lost time to see us. So let's say you get an oncology diagnosis. You don't want to wait 45 days to go see your doctor. You know, that's delaying your care. Since the Affordable Care Act, the demand to see a physician has increased 30%. So if these doctors are having a higher demand to be seen, and with the prior authorization process, it does put an impact on patients. I also found in my research that 1/3 of physicians are actually willing to manipulate reimbursement policies to get the recommended care they want for their patients. And people that are aware of the healthcare industry demands, they're actually 5 times higher to accept their doctor doing that for them. And that's important because for future care, if it's in your medical record and you go to another doctor, he doesn't know that your doctor manipulated that to get you that authorization fulfilled. So is the prior authorization dictating the care we get? Another case study that I found in my research was a 550-bed facility, and they found their largest number of write-offs were Medicare prescriptions, and they had to look at how they could overcome that. And in just 6 months in 2013, the first 6 months of 2013, they estimated they saved $4 million by looking at where the prior authorizations were being denied. And tips on reducing impact, like I said, facilities have to look at where they're losing the money and come up with a better strategy. Another thing is to use the technology available. Like Massachusetts Blue Health Insurance estimates that 98% of their prior authorizations are done online, which frees up time for the physicians. Other recommendations I came up with is the payers and the physicians are both focused on improving our health care. So why don't they work together and look at, making like a universal guideline. All health insurance, this is what requires authorizations. Rather than right now, one health insurance could say MRIs need authorization and another one could say not. That makes it a headache for providers to know what insurance companies recommend. I also say that the payers, like the health insurance companies, have to look at their processes and make sure that the two systems or, the claims processing and everything is, working together to fulfill the guidelines. And I also thought that if we do eliminate prior authorizations, we could do the post-service clinical review, use that more than the prior authorizations. As you can see from my presentation, that prior authorizations are a headache for providers and patients. I hope you enjoyed my presentation and thank you for taking the time.